Okay, picture this. The ambulance doors fly open. A patient is rushed into the ER, and you can still hear the sirens fading outside. Every single second counts. Now, in the crazy world of emergency medicine, especially when you're talking about poisonings, we all tend to think there's some kind of magic bullet, right? Some antidote that just saves the day. But the real hero, the actual first responder in the body's fight for its life, well, it's something a lot more basic.
So, let's put you right in the middle of all that action. You've got an unresponsive patient, and all signs point to a poisoning. What's the first move? What is the absolute number one thing that team is going to do? Is it trying to figure out the poison, rushing to find the right antidote? The answer is probably not what you think.
And here it is. The answer is supportive care. Before they even think about a specific cure, the medical team's main job is to become the ultimate life support system for the patient's body. It's all about managing the absolute fundamentals. We're talking breathing, we're talking circulation, just keeping things stable to give the body the time and the strength it needs to fight back.
All right, so let's dig into that. Why is this so important? Well, because it immediately stabilizes the patient, it helps with awful symptoms, and it stops this domino effect of life-threatening problems. Think of it like this. You can't really fix a car's engine while the car is literally on fire, right? Supportive care is what puts out the fire. It builds a stable foundation so that other treatments, like those antidotes, can actually be used safely and have a chance to work.
So where do you even start with all this? You start with the most critical thing of all, getting air in and out of the lungs. In medicine, they call it the A and B of the ABCs, airway and breathing. Because let's be honest, nothing else matters if the patient can't get oxygen.
And the first step can be surprisingly simple. For someone who's unconscious, their own tongue can actually block their airway. So a medic will do one of two simple maneuvers. There's the head tilt chin lift, which is the go-to, but if they think there might be a spinal injury, they'll use what's called a jaw thrust to open that airway without moving the neck. It sounds simple, but it is absolutely life-saving.
But what if the problem's more serious? What happens when a patient's breathing is so bad that those basic moves just aren't going to cut it? Well, that's when the team has to step in and take total control of the airway.
And that leads us to something called endotracheal intubation. It sounds really complicated, but you can break it down into four main phases. First, they get all the gear ready and flood the patient's lungs with pure oxygen. Second, they use meds to sedate and briefly paralyze the patient, which makes the whole thing safer. Third, they guide a breathing tube right into the trachea. And finally, they double-check it's in the perfect spot and lock it down. This gives them a guaranteed open highway for air.
And what's really cool here is how they can dial up the oxygen support step by step. A patient might just start with a nasal cannula, those little prongs in the nose, for a lower oxygen boost. If that's not enough, they'll move up to a simple face mask. And for someone in real trouble, they'll use a non-rebreather mask, which can deliver nearly 100% oxygen. It's all about giving the patient exactly what they need, right when they need it. Okay, so airway is secure, breathing is supported. What's next? It's C for circulation. We've got to make sure that oxygen-rich blood is actually getting to all the important places, like the brain and the kidneys. This is all about the body's super important delivery system, the bloodstream.
Now, to help with circulation, you first need a way in. That's the IV. It is literally a lifeline. The most common one is a peripheral IV. You've probably seen it in the arm or hand. But for really sick patients, a doctor might put in a central line, which goes into a big vein in the neck or chest. And in a true we need access now emergency, they can use an IO line, which goes directly into the bone marrow. It's temporary, but it is an incredibly fast way to get life-saving fluids and drugs into the system.
So what's actually in those IV bags? Well, most of the time it's something called crystalloids, like normal saline. You can think of them as the workhorse fluid for just quickly pumping up the volume in the body. There's another type, colloids, that has bigger molecules to help fluids stay in the blood vessels, but they're not used as much right at the start. For that initial resuscitation, crystalloids are king.
And this number right here is so important. The standard first hit of fluid, what they call a fluid bolus, is 20 to 30 milliliters per every kilogram of body weight. So for an average adult, that's like 1 or 2 liters of fluid pushed in fast to get their blood pressure up and get that circulation going again. It is a huge, immediate intervention.
But what if you've pumped in liters of fluid and the patient's blood pressure is still in the danger zone? That's a sign that the blood vessels are way too relaxed and the heart just isn't pumping hard enough. That's the cue for the medical team to level up and use powerful drugs called vasopressors, which literally squeeze the blood vessels to get that pressure back up.
So let's recap. We've got the airway handled, breathing is supported, and we're managing circulation. The big interventions are happening. Now comes the part that's just as important. The team becomes a watchful eye, constantly monitoring every single signal the patient's body sends out.
And this is where vital signs become a kind of secret language, giving the team all these little clues. A super fast heart rate, that could point to stimulants. A really slow heart rate, that might scream opioid overdose. Every number on that monitor is more than just a number. It's a clue that helps the doctors understand what the poison is doing and if their supportive care is actually working.
And they don't just stop at the monitor, they go deeper by drawing blood. They're looking for clues in the patient's blood sugar, their electrolytes, and checking how well the kidneys and liver are holding up. Something called arterial blood gases tells them how well the body's handling oxygen. And of course, this is when they'll run toxicology screens to try and finally name the culprit. All this data comes together to paint the full picture.
All right, so the body's main functions are being supported, the team is watching everything like a hawk. But there's one more piece to this puzzle, dealing with the patient's symptoms directly. This is about making them as comfortable as possible, which actually helps them recover.
And this isn't just about feeling better, it's about keeping them safe. Pain is managed, nausea is controlled with anti-nausea meds, and this is a big one. If a patient has a seizure, which is a huge risk with a lot of poisonings, they have to stop it, and they have to stop it now. They'll use a fast-acting drug like lorazepam. Tackling these symptoms is a really active part of the whole treatment.
So when you look at the whole process, we circle right back to our main point. Yeah, the antidote might get all the glory in the movies, but the real foundational work, the stuff that gives that antidote a fighting chance, is this detailed, second-by-second process of supporting the body while it tries to save itself.
At the end of the day, supportive care isn't just sitting around and waiting. It's the most important first step. It is, as one expert perfectly put it, about building a stable platform so that everything else can be done more safely and effectively. It really is the unsung hero of the ER.
Which kind of leaves me with one last thought for you. Today we shined a light on supportive care, something that does its incredible work mostly behind the scenes. So what other ideas, these fundamental but often overlooked concepts in science or medicine, what do you think are the real unsung heroes in their fields? What else deserves a closer look?